Radiopharmaceutical dacryocystography. Dacryocystography is the radiographic evaluation of the lacrimal system to localize the site of an obstruction. In diagnostic nuclear medicine, a drop of a radiotracer is instilled in the eye and subsequent imaging by a scintillation or gamma camera is performed to follow the passage of the radioactivity and the rate at which it disappears into the lacrimal system to assess if there is a stone or other blockage that interferes with normal tearing function. Radiopharmaceutical localization of tumor or distribution of radiopharmaceutical agent, S. Limited area. Multiple areas. Whole body, single-day imaging. Tomographic, SPECT. Whole body, requiring 2 or more days imaging. After administration of the specialized radiotracer, a camera, called a scintillation or gamma camera, takes planar images of the study area on computer screen or film by detecting the gamma radiation from the radiopharmaceutical focused in the body tissue. Report 78800 for localization of tumor or inflammatory process or distribution of the radiopharmaceutical within a single area in a single day imaging. Report 78801 for multiple planar, 2 or more areas, performed in 1 or more days imaging, or a single area imaging performed over 2 or more days. Report 78802 for scanning over the whole body done on a single day, and 78804 for whole body scanning requiring 2 or more days. These tests include vascular flow and blood pool imaging, when performed. Injection procedure for radiopharmaceutical localization by non-imaging probe study, intravenous, e.g., parathyroid adenoma. For sentinel node identification use 38792. This code reports the injection procedure for radiopharmaceutical localization of structures such as a parathyroid adenoma prior to gamma probe localization. Report 78803 for SPECT of a single area performed in a single day. Vascular flow and blood pool imaging are included, when performed. Report 78830 for a procedure using an integrated device containing both a CT scanner and a SPECT camera with a single patient table. This yields a SPECT/CT fusion, which is the combined display of image sets, providing both functional and anatomic information. This reports a SPECT/CT of a single area performed in a single day. Radiopharmaceutical localization of tumor, inflammatory process, or distribution of radiopharmaceutical agent, S, includes vascular flow and blood pool imaging, when performed, tomographic, SPECT, minimum 2 areas, e.g., pelvis and knees, abdomen and pelvis, single-day imaging, or single-area imaging over 2 or more days. Radiopharmaceutical localization of tumor, inflammatory process, or distribution of radiopharmaceutical agent, S, includes vascular flow and blood pool imaging, when performed, tomographic, SPECT, with concurrently acquired computed tomography, CT, transmission scan for anatomical review, localization and determination/detection of pathology, minimum 2 areas, e.g., pelvis and knees, abdomen and pelvis, single-day imaging, or single-area imaging over 2 or more days. Report 78831 for SPECT of a minimum of 2 areas in a single day or a single area imaged over 2 or more days. Report 78832 for a procedure using an integrated device containing both a CT scanner and a SPECT camera with a single patient table. This yields a SPECT/CT fusion, which is the combined display of image sets, providing both functional and anatomic information. This reports a SPECT/CT of a minimum of 2 areas in a single day or a single area imaged over 2 or more days. Radiopharmaceutical quantification measurement, S, single area. Radiopharmaceutical quantification is performed. SPECT/CT is used to quantify the radiopharmaceutical uptake in the myocardium, a tumor, or other target utilizing patient-specific information obtained from the CT data in a SPECT/CT scanner. Radiopharmaceutical therapy, by oral administration. The patient swallows the radiolabeled substance prepared in a form to be given by mouth. Radiopharmaceutical therapy, by intravenous administration. The patient is given a radiolabeled substance prepared in a form to be injected or instilled directly into a vein. Radiopharmaceutical therapy, by intracavitary administration. Intracavitary radiotherapy refers to the placement of radioactive sources within a body space or cavity, such as the bladder, esophagus, lung, vagina, or uterus, to give high doses of radiation to the cancer, while giving only low doses to the surrounding tissues. An applicator designed for placing the radioactive source within the specific body cavity is inserted and the radiotherapy is administered through the applicator. Radiopharmaceutical therapy, by interstitial radioactive colloid administration. Colloids are a mixture in which one substance divided into minute, insoluble particles, called colloidal particles, is dispersed uniformly throughout a second substance, the suspension medium. Radioactive colloidal solutions that contain natural or synthetic molecules are relatively impermeable to the vascular membrane and are useful for interstitial radioactive therapy. An applicator designed for placing the radioactive source within the specific body tissue is inserted and the radiotherapy is administered through the applicator. An example is inserting plastic tubes into prostate tissue and placing rapid-dose radioactive colloid solutions within the tubes. Radiopharmaceutical therapy, radiolabeled monoclonal antibody by intravenous infusion. Radiopharmaceutical therapy using radiolabeled monoclonal antibodies infused intravenously is given to the patient as a method of cancer treatment. This type of therapy is often called radioimmunotherapy because it combines the very specific targeting capability of a single antibody with the cancer-killing power of a radioisotope. Radiopharmaceutical therapy, by intra-articular administration. The administration of intra-articular radiopharmaceutical therapy is done to destroy the membrane through radiation, rather than performing a surgical procedure to remove the damaged membrane. A radioactive substance, such as phosphorus-32, is injected into the joint at a time when the patient has not been bleeding, and after a period of prophylactic therapy has already been done to reduce swelling of the membrane as much as possible. Radiopharmaceutical therapy, by intra-arterial particulate administration. The patient is given a radiolabeled substance prepared in a form to be introduced directly into an artery.